Hi, and welcome to another edition of the Trustcast show. And we're pleased to have on with us Dr. Mohamed Ali Rafai. And today's guest survived machine gun fire in Syria at age 8, developed thyroid disease from Chernobyl fallout at 14, and then built one of America's first emergency telepsychiatry programs. And then the federal government indicted him on 4 counts of healthcare fraud, facing 40 years in prison. A jury found him not guilty on every charge, and his memoir hit #1, Dr. Not Guilty. So when was that published?
Dr. Not Guilty came out in July 2025, and within a couple of months, it hit the #1 on Amazon in mental health law, and health law.
So I just want to make an observation. I don't detect any sort of accent at all, but you were raised in the Middle East, and I can't hear any accent in your speech.
Part of my life, I was actually raised here in the United States, and then the family went back to Syria, and I went back and forth. So had my life both in Syria and here in the United States.
Wow, what an interesting perspectives. So you had written at age 8, you watched soldiers open fire on a bus full of students from your school bus window in Aleppo. How does a child process something like that? And what did it do to the man you became now?
It stays with you for life. It doesn't leave you. It stays with you for life because we were next. We were the younger students. We were next in line for that. So you still have that memory. You still wake up in the middle of the night with nightmares about what you saw.
Yeah, that's quite a story. So you entered medical school in Syria at age 17. Was medicine the plan all along, or did surviving what you survived push you to that?
Um, Surviving what I survived, I think, pushed me to that. I developed thyroid disease at age 13, 14. 1986 was the Chernobyl nuclear incident, and there was nuclear fallout from Chernobyl. And basically, I developed thyroid disease. I developed something called Graves' disease, and my parents didn't know what was wrong with me. And because we lived between Syria and the United States, they took me to a endocrinologist in the United States, and I was lucky to have the top endocrinologist in the United States that studies the thyroid disease. He is a gentleman by the name of Dr. Lester Van Middlesworth. He's passed now. He's been passed about 10 years now. But he was the authority on thyroid disease and nuclear fallout causing thyroid disease. He had studied how nuclear fallouts from nuclear tests spread around the world by studying the thyroid of humans as well as cattle. And his data was presented to the United States Department of Energy and ultimately to the United Nations to help um, basically support the signing of the nuclear test ban treaty in the 1960s. And the data is actually still at the Smithsonian Institute. So this was my doctor. This is a doctor who saved humanity, not just one patient at a time. He saved me. He knew exactly what I had, and he treated me. And knock on wood, I haven't had any thyroid issues since then. But that was my move toward medicine.
So you came to the United States as a young researcher studying, and if I get any of this wrong, correct me, neurotransmitter signal transduction at the University of Tennessee.
Yes.
What was that transition like from Aleppo to Memphis?
It was interesting. My family had lived in Memphis, so I knew Memphis very well. I knew the University of Tennessee. I came back and actually did research with Dr. Lester Van Middlesworth during my medical school. In the summers, I would do research with him. He referred me to, I had an interest in neuroscience, so he referred me to other labs where I did research labs research work during the summer. And so when I graduated from medical school, they said, "Why don't you come back and do research with us?" And the plan was actually for me to get a PhD in neuroscience in addition to the MD, but I really like to interact with patients. I really like to talk to people, and never completed. I did a postdoctoral fellowship, but never did a PhD program, and went into my residency training at the University of Virginia in internal medicine and psychiatry.
Yeah, so it says you're board certified in 4 specialties: internal medicine, psychiatry, addiction medicine, and psychosomatic medicine. What is psychosomatic medicine?
Psychosomatic medicine is basically the psychiatric problem that portray as medical problems. And there's a lot of them. I mean, people have anxiety, and then they have what we call irritable bowel. People have depression, and they have something called fibromyalgia, where every joint hurts, where every muscle hurts. So that is the field of psychosomatic medicine.
So that's an interesting one because basically it you're talking about your health manifesting or your mental health manifesting itself on your physical health. And we see that, play out in a placebo effect the same way. I mean, differently, but the fact that your brain can make your body react in a particular way, even though nothing's really going on, it's all your body that's manifesting that effect. That's just a little observation. So at NIH, you worked on early research into ketamine,
Yes.
which is kind of controversial, right? And TMS for psychiatric conditions before most doctors had heard of either. What did you see in those labs that?
We worked on ketamine. Actually, it wasn't just labs. We did clinical trials on humans, and we did testing to see if ketamine can help depression. People who had bad depression that did not respond to anything, no antidepressants, no medications, and we said, "Do you want to participate in a clinical trial where we're testing this new medication, ketamine? It may work, it may not work."
So our audience knows. Can you explain what ketamine is?
Ketamine is an anesthetic that was discovered in the 60s and 70s, and it's used in anesthesia for people to have small surgical procedures. And it was actually used in Vietnam War. It's used in combat. It calms people down, and basically, it just doesn't cause any respiratory depression. So people don't stop breathing when you give them ketamine. They just calm down, and sometimes people have dissociation, so they feel that they're separated from their body. But it we find out that it helps depression. So people who were depressed, they got ketamine for other surgical procedures, their depression lifted.
Was that a surprising result?
It was a surprising result, so we said, "Well, let's test this hypothesis," and so we gave it to people who had real depression, and we gave some other people a placebo and saw who responded, and the people who got ketamine really their depression lifted significantly.
And so did that affect the standard of care?
Absolutely, absolutely. So, a couple of drug companies took part of ketamine, and they took part of it that they called esketamine, and it is now approved as a medication, as a nasal spray to treat depression and to treat suicidal thoughts. It's called Spravato. Yes,
Oh, that's interesting. So you published the first report linking hepatitis C to psychiatric illness.
and that's part of my work in psychosomatic medicine, looking at what medical problems cause psychiatric issues, and at that time hepatitis C was like a really unknown phenomena. It was something that was newly discovered, and there wasn't a lot of knowledge about hepatitis C. But we found out that it was associated with a lot of psychiatric issues in veteran as well as in people who have drug and alcohol issues, and we study it.
And you found the relationship there between the two.
Absolutely, absolutely, and I published the first report.
So I'm jumping around a bit because there's so much here to cover. You're rich and your background is very unusual. So forgive me if I jump around. I did more. But we only have a limited amount of time, so I'm going to jump around a little bit. So you built Blue Mountain Psychiatry from scratch, tripled its size, established the first ketamine treatment program, and the first deep TMS practice in Pennsylvania. Walk me through that growth and the process, and the not only just the growing it, but then the business side of it. You know, the amount of time and effort that it would take.
Absolutely, absolutely. So when I moved from NIH, after I did about 3 years, 3.5 years at NIH, I moved to Pennsylvania. My wife is also a physician, so we, decided to move to Pennsylvania because she was, gonna enter her residency in OBGYN. So for a little bit, for about 3 or 4 years, I worked for a, local hospital system, and that's where I said, "You need telehealth, you need, telepsychiatry." And we established the first telepsychiatry program in the nation, emergency telepsychiatry program in the nation in 2006. People at that time thought was telemedicine was a toy, like people, you and me talking on TV or with talking with patients. It wasn't, nobody knew about that. Like talking to a patient through a video camera, that wasn't unheard of. This was 20 years ago. Exactly 2006. This is 2026. And, basically, we established it. We connected the emergency rooms of 3 different hospitals. So I was in one emergency room, and I would see patients in the 2 other emergency rooms that were about 20, 25 miles away, and would be able to process patients and help them, get them the care that they needed while they're waiting to either be admitted or they're waiting for psychiatric, care. And, basically, that program became the nucleus for other programs of telehealth. About 2 or 3 years later, they came to me and said, "Well, we wanna implement the same program that you did for the intensive care unit." We would have doctors in one intensive care unit, and they would see patients in other intensive care unit. And lo and behold, 10 years later, COVID came, and tele-ICU was instrumental in saving a lot of lives during COVID. Telepsychiatry, was also instrumental in saving people's lives, during COVID.
Well, that's got
But
to be satisfying because I would believe that when you first came out with something like that, you say in 2000, was it six?
2006, yes.
So they people were probably laughing their ass off, saying, "You're crazy. This will never work. It doesn't. It's just insane."
I think, and I was lucky because I had a hospital CEO that was that was a dreamer. And actually, that was very expensive program because the equipment was very expensive. We paid $5 million to what we get now, what we spend with like $100 phone, $5 million to connect 3 ERs. And, the CEO was a dreamer. He says, "I'm believing in this program that's gonna work for the future." And it did. So I think that was a very positive thing that they believed in me and in this program and then implemented for tele-ICU. So I think, you just have to be in the company of people who are dreamers and believers, and magical things can happen.
You must be a good storyteller, though, in order to convey the whole story behind it.
Absolutely, absolutely, and I have other books that are coming out with, telling these stories. The story of telemedicine, the story of hepatitis C, they're all coming out in subsequent books to my book, Doctor Not Guilty. I have actually a book that's about to go into publication. It's called Hijacked Minds: How Addiction Rewires the Soul, and it's talking about my work on addictions also.
So before the time gets away from us, let me jump into Doctor Not Guilty. So in 2022, you were indicted on 4 federal charges of healthcare fraud, facing 40 years. Take me back to the moment that happened.
It was a very stressful moment. Um We had known that the federal government was doing an investigation. They had told us that they were doing an investigation, but I never expected that this gonna be a criminal indictment. The government did not believe in my services, and the reason why I was targeted is because I was an outlier. I was somebody who was doing telehealth between 2006 and 2020 when nobody else was doing it. and the rules were not clear. They were clear to me. I knew exactly what were the rules. I knew exactly what was the right thing to do, but the government wasn't sure. And this was like the beginning of COVID. And they wanted to teach a lesson about telehealth because, what happened with COVID, the volume of telehealth was 0.01%. And then you flipped a button, a switch, and then 100% is all telehealth. And so basically, they never had anybody that had done telehealth, and they looked and they said, "Oh, this Dr. Rafai, there's some suspicion about his services. Let's charge him, and maybe we can teach a lesson to everybody who's doing telehealth to basically just be extra cautious." And I knew all the rules. I had helped write the rules, and so the government didn't know the rules.
So who was what jurisdiction was that happening in?
This was in Pennsylvania. This was the Eastern District of Pennsylvania, so out of Philadelphia. And I was being investigated by the Office of Inspector General for the Department of Health and Human Services. And they couldn't find an expert that knew anything about the rules of telehealth.
So you were the expert, but you were being prosecuted, so they couldn't call you.
Yes. Yeah. Well, I found experts that knew the telehealth rules, and I found another psychiatrist who's done work in telehealth, and they came and testified on my behalf. I only had two witnesses in my defense.
So it says here the trial lasted 6 days. The jury deliberated for just 2 hours before finding you not guilty on all charges. What went through your mind right before you heard the verdict and when the jury came back in?
I was prepared for the worst possible outcome. I mean, you never know a jury trial is always a gamble. It's always like a Russian roulette. I was resigned to the idea that I was just gonna go to jail. In fact, actually, 3 weeks before the trial, and I write the story in my book, Doctor Not Guilty. I actually asked, if I am convicted, which jail would I go to? And I was told that the best jail in my area to go to was Otisville, New York, Otisville Federal Prison. And it's about 2 hours, 2.5 hours from where I live. I traveled there just to be at peace, to say, this is where I'm going to be. If I'm going to go to trial, I got to be prepared that this is where I'm going to spend some time of my life.
So your wife, I mean, you were married,
Yes.
and
Yes.
do you have children too?
I have 3 boys. Yeah, I have 3 kids.
So that must have been absolutely traumatic for just the process. I mean, the of building up to that day.
Yes. Yeah. And I had my parents. I have my mom and dad came to the trial, and this is the like one of the few times where I saw my dad crying after the not guilty verdict.
I can imagine. So, what did the prosecution get wrong about how psychiatry actually works, especially telepsychiatry?
Everything from A to Z. They got everything wrong. This is why the jury found me not guilty. Um,
Give me some more insight into your book that's not covered in my questions here.
sure, sure. So telepsychiatry rules basically says that if you interact with a patient, that the interactions are not just you talk to somebody and you prescribe a medication. You do something called psychotherapy, meaning which is talk therapy, just like I'm talking to you, but more in a therapeutic way. The government's version of the story is that we talk to the patients for very brief visits and just prescribe them medications. And our version is psychiatry is talking to people. It's not just medications. Medications is a component of that, but talking to people. And so basically, we demonstrated that we actually talked to people, that we did psychotherapy, that we basically alleviated the suffering of patients. It wasn't just we just wrote them pills and sent them on their merry way. And unfortunately, the government, the patients that they chose. were patients in distress. And they wanted to argue to the jury, for example, that a patient who was a resident in a nursing home, where the nursing home is telling us the patient is having suicidal thoughts and is depressed. The government argued to the jury that this patient didn't need anybody to talk to them. Just give him a pill and he'll be good. And the jury didn't accept that. We said we provided psychotherapy. This just we're being told this is a patient who wants to end their life, who wants to die. You talk to them. The government version was you just gave them pills and went on your merry way. And our record demonstrated that was not true.
So did you get a chance to ever talk to any of the jury or your
We never got a chance to talk to the jury. After I found the not guilty verdict was spelled out, I just ran away, me and my family, as fast as we could away from the court.
Yeah, I can see that. So let me do some rapid fire stuff just for fun, kind of break this up. So first language you dream in, Arabic, French, or English?
Arabic,
A meal that takes you back to Aleppo.
grape leaves,
Okay. Ketamine or TMS if you could only have one tool.
TMS.
Best advice your wife, Duha, has ever given you.
Never talk to the police. And that actually saved my life because I never talked to the investigators. Had I talked to the investigators, they would have used everything against me. You can't explain your way out of an investigation. We decided not to talk to the investigators, and my lawyer said, your best chance is to present things in court. Because whatever you're going to tell the investigators, they're going to write their own version of what they heard from you.
Interesting. So is your wife also from Syria?
She's also from Syria, yes.
So do you think that is kind of maybe suspicious nature because of the events in Syria have helped really kind of preserve your life the way it is?
Her dad is a physician, but her dad is also a police officer in Syria. So she's not, never talk to the police. I know my dad is a police officer. My dad is the doctor for the police, and she said never talk to the police.
Yeah, I'd say it's amusing. It's more like interesting, but it is kind of amusing too, just to hear that story.
And there is, I mean, like even police officers and judges and lawyers. If you look on YouTube, there's a very famous lecture by a lawyer and a judge, and he says never talk to the police. It never helps.
So the one thing you wish every patient knew about psychiatry.
In psychiatry, medications are a crutch. The way to improve in the field of psychiatry is to do self-work and talk therapy, and medications are only a crutch.
Favorite psychiatry movie or show?
Psychiatry movie. There's many. There's one the name of the movie is Girl Interrupted.
Okay. So if you ever get a chance, there's a show on one of those channels called Vienna Blood. And
Okay.
it's based in the I think it's in the 1800s or early 1900s, and it's
Uh-huh.
about the psychiatrist who becomes kind of involved with this policeman and is solving crimes. It's very interesting, very interesting. So if you get a
Look it up.
chance,
I'll look it up.
Vienna Blood. Okay, so you founded an organization called Shield to help other doctors facing prosecution. What does
Yes.
that look like in practice when a physician calls you?
Um, Physicians call me in various degrees of their prosecution. My preference is for somebody to call me whenever they know that they're under investigation, but unfortunately, a lot of physicians don't know that they're under investigation. or don't know that things are going into an investigation. Whenever the federal government starts an investigation into a physician, my thought is that it's a train and starts from station A, and station C is conviction. It doesn't stop. There's no way to stop it. So physicians need to know that. And basically, if the federal government starts an investigation, rarely does it end in a positive way. Their goal is to convict somebody. Their goal is a conviction. Their goal is seizure of the physician's property and any money that he's made, um, and kind of finding evidence against the physician. So any little small error that, and we're humans, any little small error is basically targeted against the physician. Now, there are physicians that will do things that are criminal, that deserve to go to jail, but 99.99% of physicians are well-meaning and don't do any criminal things, but the government kind of amplifies that.
So what sort of situation have you seen that you could talk about, and you could say none, where someone other than yourself was where the government pursued them with illegitimate claims, just from your estimation?
I talk about somebody who basically um, actually went to trial, and unfortunately he was convicted, and his case in appeal. But it was so egregious and outrageous what the government did, and probably affected the results of the trial. And this probably will be on appeal. But a physician who was an OBGYN, and there was a dispute about OBGYN procedures that he performed, legitimate procedure. He's a obstetrician and gynecologist that treats cancers in women, and the government accused him that he was doing procedures unnecessarily, but they also accused him of rape. Now they basically construed that the procedure was done unnecessarily as rape. And, ultimately, the court did not accept that, but that wasn't after they sullied the reputation of this physician that he raped women, even though he was trying to do appropriate procedures to discover cancers in these women, but they put the reputation that he raped these women. The government dismissed those charges, and the court actually dismissed those charges. But, basically, his reputation was sullied, and he was ultimately convicted, and his case is in appeal. So the government would sometimes would do egregious things.
So, so what needs to change in how the federal government investigates physicians when something
I
they
believe I believe that when a federal government decides to, indict a physician, a dentist, a pharmacist, there has to be a panel of physicians that listen to the case and give opinion to the federal government, and and it's not the state medical boards. It has to be an independent panel, expert in the same field that would sit in judgment of their fellow physician to say whether this was something appropriate or inappropriate, and that the federal government would get guidance about what this physician has done, and not try to basically trick the jury into convicting physicians.
Well, this is a really interesting topic. So after everything, Syria, thyroid disease, building your practice, the indictment, the acquittal, what keeps you treating patients every day?
I'm back. My license is active and unencumbered. I have no sanctions or any issues against me. I'm trying to create to clear my criminal record, which has an arrest record, but says that I was found not guilty. So I'm actually on a pursuit to see if I can get expunge my record. There is no federal expungement, but I am working on that, and actually my case is in the, United States, Court of Appeals for the Third Circuit, and I'm gonna argue whether the case should be expunged.
Interesting. So where can people find the book, connect with you, or learn more about Blue Mountain Psychiatry and Shield? Or are those all different locations?
Different organizations where people can find me. My book is on Amazon and Barnes& and Noble, and you can visit my website, drnotguilty.com, one word, drnotguilty.com, where you can see my book. You can also visit my website, alirafai.com, and you will have all the resources, my practice. We also do consultations through Shield, and the website is shield.expert.
Okay. Well, great. Thanks for being with me, Mohammed. I really appreciate it. You're a great guest. Hang on just with me for just a second here.